All right, so we are live. Good evening, everybody. It is yours truly, Dr. Pierre, your favorite board certified internist. Welcome to another episode of The Real Physician Reacts. Again, last week we did not do an episode. I finally come to the conclusion that when I'm on nights, like that just ain't the week I'm just gonna do it, right? I'm reserved. I'm okay with my decision, especially because every time I think, you know what? Maybe I could do a little bit earlier because typically when I do my nights, I do nights from 7 p.m. to 7 a.m. And I think, oh, well, maybe if I do a 6 o'clock nights, but typically I got to do dinner for the kids and it just does not seem to work out. And then what happens is the post call, like I'm so tired that there's no way I can do an episode like this during the day. So I just never do it, right? So I've just come to the conclusion that when we are on nights, and I'll let you guys know when I'm on nights, it ain't gonna mean no Real Physician Reacts, right? But again, this is your first time catching this. First of all, shout out to you. I know we have a few new subscribers to the YouTube channel. Make sure, depending on wherever you're watching this, whether it's on Facebook, whether it's on LinkedIn, Twitter as well, like make sure you roll back and subscribe to the YouTube channel. I'd much appreciate it. The link is drbarrierpierre.com/YouTube, and they'll take you right there. So this is my live weekly series where we just kind of talk about something that either crosses my social media platform, hits my email, hits my DM, one way or form, and then I just kind of give my personal reaction to it. And this week we have a doozy. The title is "Show Me the Money," right? And if you're able to catch the description or the YouTube cover art, we're going to be talking about a health fraud case that involves an internist out of the state of California to the tune of $9.5 million. Yes, that is right. $9.5 million. He ended up defrauding Medicare, and I guess in California there's a thing called Medi-Cal. He ended up defrauding them for $9.5 million, had to pay restitution, as well as some jail time, as well as some probation. But I want us to kind of get into the weeds of it all, right? So let's you know how we like to do. Let's get to sharing, so you guys are kind of fully aware of what's going on our end here. Let me get to the page. All right, so did I go to the wrong page? Oh, I went to the wrong page. Why did I get my page back? Oh, hold on for a second. Hold on, I lost. I would lose my page right when I get to it. Give me a second. Perfect. All right, there we go. Let me get this sharing back on here. All right, so make sure. Yep, we are good to go. So, Los Angeles doctor to pay $9.5 million to resolve allegations of fraud against Medicare and Medi-Cal, right? And it talks about this doctor by the name of Dr. Minas Kochumian. I apologize if I'm pronouncing that incorrectly. Who is a practicing internist, has paid. Now, mind you, he had the bread. First of all, like I know I'm in Florida. I know I'm pretty young in the healthcare realm. But the fact that he was able to pay this amount, 9.4, we're just rounding up to $9.5 million in allegations that he submitted false claims to Medicare and Medi-Cal for procedures and tests that were never performed. Yeah, like these payments include nearly $5.5 million paid by Dr. Kochumian as criminal restitution following his guilty plea to one count of healthcare fraud. So let's pause right there, y'all. So this man received he received upwards of millions of dollars in faulty claims, and because he received it, they tacked on that $5.5 million price tag. So he didn't necessarily bill him for $9.5 million over. I think it looks like if you calculate the numbers, it was about close to $4 million over, and he had to pay back 5.5 on top of that just because he pled guilty, right? So I want us to think, because especially in the eyes of the general public, right? And what I've noticed, especially when I go on my social media platforms and I go and I say some things on social media, I realize that the general public really does not know what goes on in the healthcare space. So I think the general public has this idea, I say it all the time, that all doctors are rich and all doctors got plenty of money and we're always golfing every weekend and everything's bliss. Now, clearly I can tell you, and I could be number one example that is 100% not the case. But what this goes to show is, like, you have an internist who would say, you know what? Like, I am in desperate need of this money, and I figure out a way to get this money that I can probably sneak it by. And he probably would have got away with it if it wasn't for, and we'll talk about it, his medical assistant who was working with him, and I think an insurance or just some instructor that's in his office. So essentially, two of his office staff snitched on him. I hate to call it snitch because they weren't, I'm assuming, right? I'm assuming they weren't doing anything, but two of his office staff told on him that he was doing this illegal affairs. And then like I said, we'll talk what's crazy is in healthcare fraud, there's a whistleblower fee. So I think they got about $1.7 million of the total 9.5 that he's given out. Like 1.7 goes to the whistleblowers, right? And again, we'll talk about that, but let's kind of rewind. So when you have, and I had to explain this to a colleague of mine because he was just trying to figure out, like, you know, from a hierarchy standpoint, who gets paid the most, who gets paid the least. So in our world, we know that in general, the people who get paid the most are the surgeons, the dermatologists. Those two tend to lead the pack, and the people who are on the bottom of the pack, again, not slouching, but they're still on the bottom, are typically your family medicine physicians, internal medicine physicians, pediatrics. Those are probably the three, right? Maybe neurology too, but like definitely those three. And I had to explain to him why, because like I think he was very shocked when I mentioned that the dermatologists were on the higher end. And for what people may not know, like I said, again, I've learned very quickly that I don't expect everyone to know what's going on within the medical field, because you don't have a lot of people like me kind of telling you guys what's going on in the field. So in medicine, the majority of way for folks to get paid is by doing procedures. And let's say if I'm talking, like right now, every Thursday, or if you catch my Medicine Monday episodes, every week I may come to you and I talk to you about a health topic: diabetes, hypertension, COVID-19. Just me doing the talking, the education, in the grand scheme of things, that doesn't really pay much, right? Like, and we'll scale it out. Let's say it pays $1, right? Let's say it pays $1 for me to do the talking, right? The educating, which when we think about it, our family medicine physician, our internal medicine physicians, our pediatric physicians, they're the ones who are primarily doing a lot of the education. A lot of their, practice is about educating their patients, counseling their patients. So the talking only gets you $1. Now let's move to the people who do the procedures. If you need a procedure, aka a surgery, because your blood pressure wasn't controlled, aka a surgery, right, because maybe you have some skin growth, aka some type of procedure, right, because something happened and your kidneys are bad because you didn't listen to your primary care doctor when he told you watch your blood pressure. Those procedures may pay in the thousands of dollars, right? So again, we got $1 for the education, thousands of dollars for the actual procedure. So that's why, so just so we all can kind of wrap our minds why the procedure type folks and procedural specialists and specialties tend to get paid more, because the act of doing a procedure in Medicare's eyes pays more, right? That's just unfortunately the way they've constructed our system. And, again, we're not here to call out none of my specialists, right? But who do you think sat at those tables when they were trying to decide, hey, an RVU, one RVU for talking but 1,000 RVUs for doing procedure, right? Again, not here to have that type of beef, right? We're here to talk about healthcare fraud. But I want to talk about that because when you hear a lot of these, especially when it's involved with a physician, when you hear a lot of these physicians involved healthcare fraud, it's always due to them doing or not doing, more importantly, a procedure to a patient and billing that patient for said procedure. It's because I can assure you, if I was trying to hit Medicare fraud by counseling my patients, I couldn't talk long enough, right? There's not enough patients in the world for the education and the counseling behind the education and that level of fraud to add up to $1 million. Like, again, I'd be talking to essentially this whole state of Florida. Like, I'd have to bill for like the whole state of Florida from an educational counseling point, right? Just to try to get to like $1 million, right? So clearly the best way to do it is to do procedures, right? Or the best way to try to finagle, right, this healthcare system, Medicare, Blue Cross, all these insurances is through doing procedures. So of course, this is what he was doing in the premise, right? And now let's go back to just so we can. I want to make sure we kind of get down to the premise here. Let's see here. First of all, let me talk about it. So the civil settlement. Let me get that big so you guys can see it. The civil settlement with Dr. Kochumian resolves allegations originally brought in a lawsuit filed by relators Elize, Oganesyan, and Damon Davies. Again, I apologize if I'm saying those names wrong. Dr. Kochumian's former medical assistant and former informational technology consultant, right? So they were the two who said, you know what, something is fishy, and I'm gonna tell somebody, right? So they were the ones who did it, and this kind of mentioned how they will receive more than 1.75 million of as their share because of the case, right? And they kind of mention, you know, this aspect of the Hippocratic oath, and Dr. Kochumian alleged misconduct violated trust of his patient in his care, and he selfishly pocketed funds that he would otherwise have gone towards critically publicly funded healthcare services. First of all, let me stop myself right there, right? First of all, this idea that if this specific doctor wouldn't have done this fraudulent activity, that they would have taken that money and give it to needy healthcare related services in the area is just BS, right? We know that, right? This is a Real Physician Reacts, right? So we can talk truthful, right? We know that, like, if Medicare and Medi-Cal had a surplus of money, they wouldn't just take that surplus of money and then say, oh, you know what, let's give it to this community center here. Let's give it to this, population that clearly needs it, clearly can't afford the medications. Wouldn't happen whatsoever, right? So, we can call BS because, this is the series where we can call BS, right? And as a physician, I have no problem calling that BS. But you have here where you have the two people who worked in his office, and the scenario occurred is that you had patients coming back and saying, hey, like, and for, again, you may not know it, right? But like when you go to your doctor's office, your insurance company typically gives you like a bill, even if you're not actually paying, right? Because you have a lot of patients who they may have Medicare, then they have a supplemental insurance. So they literally pay nothing, quote unquote, out of pocket when they see the doctor, because they just, Medicare covers like, I think 85% or 80%. And then the supplemental insurance covers the other 20%. So they don't pay nothing, but they still send you a list of charges, regardless if they're paying or not. Because insurance is like, hey, we just want to let you know, hey, this is what's going on. So, of course, you started having more and more patients coming up. And trust me, I know the typical Medicare patient, when they get that bill, they're not like, oh, okay, and they're throwing it away. They're typically going to read that bill, right? Because they just want to know. So they're looking at their bill and they're just seeing all of these procedures and things happening. They're like, hold on, I didn't get any of this done. I'm not sure why this is on my list. Now, mind you, that doctor is probably thinking like, hey, I can do it to this person right here, because they don't get a bill anyway. So it's not like they're going to have to come out of pocket and pay something, right? Because clearly, if something were occurring where I would have to come out of my pocket to pay for a procedure that I never got done, I'm stopping that quick, fast, and hurry, right? Like you're not growing to millions of dollars of fraud if people had to take money out of their pocket to pay for the fake procedure. But it can slip when people aren't typically having to pay. And I'm pretty sure the way he targeted those people, he knew what he was doing. So you have a situation where patients are coming back, they're asking about their bill, they're asking about these procedures, and again, allegedly, right? I have to say allegedly because again, for all I know, right? For all I know, the whole office was into it, right? For all I know, I don't know, right? But you have to believe that, let's say, just based off the the evidence, that they weren't. So what we know is that when patients started coming in and saying, "Hey, I don't recognize this charge, I don't recognize this bill," the assistant was like, "Hey, like, yeah, we didn't do any of this. Like, we can't even do this. Like, there are some procedures that you need a special equipment that clearly this internist did not even have. He was just, again, billing to bill, right? Again, greed, because greed is crazy, especially if you're getting away with it, right? So he's billing for these fraudulent claims, right? And eventually it catches up to him, right? Eventually the medical assistant and the what is it? The what was that title? Interesting title. The informational technology consultant. Have no clue what that is. I have no clue. Maybe that's the person who does your EMR, electronic medical records. I have no clue what a informational consultant would be. But you had this person say, "You know what? I don't like this. I'm turning you in," and then eventually he gets turned in. And what's funny, right? Not funny, but what's funny and interesting is that when you do a Google search for a healthcare fraud, especially on Google, right? The first 5 or 6 websites that pull up are like law firms, right? They're like law firms that say, "Hey, do you suspect this healthcare fraud? Is there anyone you want to tell on?" Right? Like it's comical to me, right, that the law and I commend them for it, that they would jump on something like this, right? Like when I looked at the numbers, right, there's even an organization, which again is hilarious, the National Healthcare Anti-Fraud Association, y'all, which is it's hilarious. But one thing I've always said about the physician, right? And when I talk about understanding our level of importance, right? When I talk about when I'm in the hospital, I recognize that the reason why the lights are on in this hospital is because someone went to medical school, right? Like that's it, right? The reason why those lights are on in the hospital because someone went to medical school and they went to residency and they passed their boards and now they're practicing, right? Because there is not a hospital in the world that would be able to run without a physician, right? And even better, right? When I think about hospitals and how hospitals get paid, kind of going back to that same kind of thought process. I'm an internal medicine physician. I'm a hospitalist physician. So me seeing the patients, right, from a hospital standpoint, let's say it gives the hospital $100, right? Me seeing the patients as a hospitalist, taking care of their stroke, taking care of their heart attack, taking care of their pneumonia, treating them after COVID-19. But if I'm a proceduralist, like let's say I'm doing intubations, let's say I'm doing lines, I'm doing surgeries, that hospital is going to make thousands of dollars compared to my paltry hundreds of dollars from me doing the talking, right? Just again, so when I tell you that this system is so flawed that it encourages people like this doctor here to try to think of a way to try to game the system, because they know the system says, "Hey, if I can just figure out a procedure," or another fraud that they're doing is that they're doing these medical equipments, right? Like they're ordering wheelchairs and walkers and all these things there, and they're bilking Medicare, right? Charging Medicare, let's say $100, but they're not even bringing the walkers to the patients. Patients don't even need it. So again, just another way, right? So typically procedures and these medical equipments are two common ways to get, to try to fool Medicare to paying them some money. So I just want to share my screen here so we can see this hilarious organization. Make sure, yep, perfect. Make myself a little bit smaller. Good. So again, we have the National Healthcare Anti-Fraud Association. There's members, like you can be a member in an organization like this. Again, just want to kind of they got meetings. They got what about healthcare fraud? The challenge of healthcare fraud. And I was looking at the numbers, right, just to try to figure out from a cost standpoint, how much does healthcare fraud? You can kind of see some of their sponsors here, which again are kind of hilarious. But you would think the people who are, who want to make sure that there is no fraud would be the insurance companies, right? Because they're the ones who are eventually having to pay out. So this here talks about a conservative estimate of 3% of the total healthcare expenditures, while some government and law enforcement agency place the loss as high as 10% is due to healthcare fraud, right? So again, and that look that number, that's 300 with a B, y'all. So about 300, like, first of all, we spent, just gives you an idea how much money we spend on healthcare in this country. $300 billion, right, is attributed to fraud, right? So, which is a lot of money, right? So if you're one of these big insurance companies, right, you want to see that number cut down, right? You want to encourage people, encourage office staff, encourage other doctors. You want to encourage those types of things not to happen, because that's going to put billions of dollars in your pocket at the end of the year, right? So again, I understand, right? Like, of course, they try to hit you with this altruistic, like, again, when we have to pay this $300 billion in healthcare fraud, that means we can't give the $300 billion to those in need. Fam, the only people who you actually planned on giving that $300 billion to was your investors and yourselves, right? You had no intentions of just giving it out just because it's there, right? So again, I like the fake altruism associated with those trying to fight healthcare, but we really know what the issue is, right? The issue is that especially physicians, now mind you, and I'm not saying that only physicians in the lower tier do this, right? Physicians in the higher tier also try to build Medicare. I was a resident. Resident or attending? I forget. It was. I know it was early in my career or late in my resident career, where we had an ophthalmologist, again, another surgeon, built, Medicare for, like, again, millions of dollars, right? That, that he had to answer for. And it was because he had his own surgical center. And I mean, he was just doing it, right? Again, I applaud him for, I do applaud him for trying, right? So it's not like only the lowly specialists are the ones doing it, right? Like, everyone's doing it, right? Across the sphere, right? And again, it's not just physicians, right? It's nurses, it's specialists, it's these diagnostic medical equipment companies, right? Like, everyone is trying to figure out a way to sliver some bread that they shouldn't be deserving. But of course, the person who's always gets hurt is the patient, right? Like, the person who always, feels the brunt of it is always going to be the patient, right? Which is definitely why, again, as obviously I don't champion any healthcare fraud, right? But I 100% understand the mindset, right? I 100% understand them saying, like, man, look at all of this money out here that I'm not getting, right? Like, that's what they're thinking, right? They're like, man, these insurance companies are making billions of dollars a year, right? And I got to fight for the little pennies that they give me after, everything is done, man. If I could just figure out a way to, snag maybe a couple of 100,000 every year, right? Just under the low, like, I'm gonna try to do it, right? And that's the risk they take. Now, if you ask me, as a physician who put blood, sweat, and tears to get my medical degree, right? There's absolutely nothing that you could convince me to do that would let me say, you know what, let me put my medical license in jeopardy, right? Like, and I think the way they kind of mentioned that his license expires this year, and I think it's obviously going to be very difficult, not impossible, but it's going to be very difficult to try to get that renewed, because now, of course, every time you go to renew it, you got to answer the question, like, oh, why was your license suspended? Oh, yeah, I went to jail, right, for Medicare fraud, right? Like, it's going to be tough, right? And then imagine imagine trying to get back on Medicare. I assume, right? Don't quote me on it. I just assume that if you build Medicare and you still have millions of dollars for Medicare, they're probably not going to let you go back on Medicare. And for those in our world, we know that Medicare, especially for those who take insurance, shout out to my direct primary care folks, and that's the primary care, but I know it's mostly primary care. Those who take insurance know that Medicare is a lifeline, right? Like if you don't take Medicare, like it's going to be a long, long day, right? Because a lot of people like have Medicare. Medicare tends to pay the most, right? So just a quadri of thoughts when we think about healthcare fraud, when we think about physician pay, healthcare workers pay, and more importantly, again, shout out to the whistleblowers, right? Because it's a nice payday, right? Like again, they talked about $1.7 million, right? It's a nice payday. So if anyone is watching, watching me this evening or catching me later on, right? And you work in, a physician's office, or you work in a diagnostic medical equipment company, and they're doing some unscrupulous things, like, hey, you know what? Especially if you're innocent, please be innocent, obviously. There's an opportunity to cash out, right? It just is what it is. There's an opportunity to get some bread if the bread is available, man. So again, I'm yours truly, again, Dr. Barry Pierre. Again, welcome back to another episode of Real Physician Reacts. I'm going to see you guys next week, y'all.